Is it okay for us to start now? Others can just join in as we go.
Sounds great. Thanks, Audrey.
Okay. Hello, everyone. I hope everyone is so excited to be a part of this launch. Let's just take this time to introduce ourselves in the chat box. But as we do that, let's have our youth moderators introduce themselves. You can just tell us their names, their countries, where they're from, their organizations, while the rest can just type in the chat box. I see others are still coming in.
Audrey, would you like to begin?
Yes. Hello? Hello?
We can hear you, Audrey.
Oh, I was saying welcome, everyone. It's a pleasure to have you all for this launch. Without wasting much of our time, I understand that we had a technical glitch earlier. So let's just have a round of introductions. People can just type in the chat box. They can just tell us their name, their age if they're comfortable, and the country that they're from. And we can also have our youth moderators share with us their names as well as their organizations and countries. So maybe we can start with Chandra.
So hi, everyone. I work for WHO. I've been in WHO for just over 25 years. I'm 62 years old, and I'm originally from India. Though I've lived and worked in Zambia for 10 years, Zimbabwe for a few months, and here in Switzerland for over 25 years. So really excited to be part of this exercise, and we contributed actively to the update that has been launched. Over to you, Audrey.
Thank you so much, Chandra. It's a pleasure to know that you were once working in Zimbabwe because that's where I'm from. And I'm also with an organization called Youth Engage. I'm a programs officer there. We mostly deal with adolescents and youth sexual and reproductive health services, ensuring that they all have access to it. Let's move on to someone else. Anushka, do you want to introduce yourself?
Sure. Hi, everyone. My name is Anushka Kalyanpur. I work with CARE. I am the Sexual Reproductive Health and Rights in Emergencies team lead. And I also co-chair the IWAG Adolescent SRH Subworking Group. So I've also been a key part of this toolkit development and very excited to work with you all today. Thank you.
Thank you so much, Anushka. Nina, over to you.
Yes, hi everyone. My name is Anina Bina David. I am the country coordinator for International Youth Alliance for Family Planning here in Tanzania. But I also sit as the youth focal point for Family Planning 2020 in Tanzania.
Thank you so much, Nina. May we please all be interactive in the chat box. We're still waiting for your introductions, your names, your ages, the organizations that you're coming from, or even if you just joined in as yourself. Please note that everyone who is moderating this session is a young person. So it's a very important launch for us today. So without wasting, is Shukti in?
Yeah.
Okay. Oh, yes. Shukti, sorry, you hadn't introduced yourself.
Yeah, I'm Shukti and I'm from India and I'm from the YP Foundation. So it's very nice to see you all and I hope we can have some great conversations today.
Definitely, definitely. Shukti, I'll hand it over to you because Shukti will give us a rundown. Is it Shukti or Nina who's giving us a rundown of the chapter 1?
It's me, Audrey.
Yes, thank you so much. I'll hand it over to you.
Great. So just to begin, we understand that adolescent sexual reproductive health may be referred as an emotional or physical well-being of adolescents and includes their ability to remain free from unwanted pregnancy and have unsafe abortion, STIs such as HIV/AIDS, and all forms of sexual violence or coercions. So, as we can see, there are different subgroups of adolescents that are would say that are at increased risk. And as we can understand that adolescents are termed from 10 to 24 with different subgroups of 10 to 14 being younger adolescent, and then 15 to 19, and then 19 to 24. And they're from the toolkit, and they are at risk with such situations as I've mentioned before, unwanted pregnancy, unsafe abortion, and STIs. But also, the factors that are individual, interpersonal, community, and structural level that can help hinder adolescent accessing and using SRHR information and services are, when you speak of individual level, when you speak at, there are multiple levels that we can speak about it, but when you speak of individual level, for example, at a center where adolescents are the model, their biological and personal attributes, attitudes, beliefs, and experiences with obtaining sexual reproductive health information and services within their families, communities, and their health system affect their ability to seek quality information and services. For example, when we were speaking about the story of Ilo, missing information from menstruation cycle or menstrual information to pregnancy information. And these factors, all this includes factors such as age, personality, sex, mental health, agencies, awareness, and so many others. Another level would be interpersonal or relationship level, where that relationship of adolescents that they have with their family members, with partners, peers, community members, and other social networks play a role in adolescents' ability to seek sexual reproductive health information and services. Their attitudes, beliefs, behaviors, knowledge, norms, and values influence how adolescents seek information and services. And other family level factors that include household income and wealth. And we again, using the same example of the story that I just narrated earlier, we see how the family level and the condition of the household itself affected ELO in terms of understanding or accessing such information. And we have a community level where adolescents live and socialize in communities that are made up of schools, of workplace, of neighborhoods. And in these communities where there's social and cultural norms that restrict or support access to sexual reproductive health services. And then there are taboos that you cannot discuss sex or cultural norms that surround adolescents. And well, I would love to use the same example of Ilo, where it was a taboo to speak about menstrual hygiene or menstrual cycle, what it was all about, and she had to hide it because she didn't really know how to deal with it at the beginning. But the other level is a structural level, where the level refers to maybe infrastructures and the system surrounding adolescent. There's an ability to obtain information and services that influence by the availability of health facilities and the safety of the community, as well as the policies and laws that restrict or support access to sexual reproductive health services. For example, in humanitarian settings that we're all talking about today, however, the infrastructure or the system may be disrupted, partially or functionally, or does not exist or non-existent, but there has to be a system where adolescents can get sexual reproductive health services and information. Well, now to everyone, I would like to ask one question or two. So how do we think our organization will use the guidance and the tool in our projects, in our activities from this chapter? Welcome, everyone. I think we can unmute ourselves if we would want to reply. Oh, and we can see the questions. Yes. Sorry, Anushka, you were saying?
No, go ahead. That's what I was going to point out, that there are a few responses in the chat. So please go ahead.
Oh, okay. I cannot.
I can read them out if that's helpful. So we have Judith
Yeah.
has said that she will use this toolkit to influence policy changes. Everjoy, hi Everjoy, who's also from CARE, mentioned that she will use it to open or initiate discussions with communities and to understand barriers. Great. Anyone else who would like to respond to the question? How do you think your organization will use the guidance and tools from this chapter? Vivian says it will be used as reference material.
Hello, this is Lorelei Goodyear from FP 2020, and we are kicking off the recommitment process for FP 2030 starting tomorrow, and we've just this last week received our first country commitment from Mali, and I shared with them the ASRH
Anushka,
toolkit.
I can hear the discussion from, I think, another group.
Oh, we can all hear Lorelei speaking.
Yeah.
Yeah, so basically,
Was
I
a
think
little
that
bit
the
faint.
toolkit will be very useful for countries that are making commitments to take into consideration the needs of adolescents. And in the Mali example, the country had an objective around youth and a separate objective around strengthening supply chains to hard-to-reach populations. But by providing them with the guidance in the toolkit, I'm hoping that they will put those two ideas together and think about the needs of adolescents in conflict areas.
Right. I hope we all heard, sorry if I misspell your name, but I think what I heard was from Mali, they've begin the recommitment process for FP 2020, and I think by using the tool, they'll be able to get more information and be able to set a commitment using the tool. I hope that's correct. Great, thank you. Anyone else before we move to the second question?
Yeah, let me come in here. You know, often
Yes.
we are asked in WHO about what's happening in the humanitarian context. And as you all know, adolescents are essentially left on the sidelines of any of these discussions. And having a tool like this, which has been co-created by so many organizations working with young people and by young people themselves, is a very powerful resource to have. So I think what we must do very much is write up a paper, have it published to describe the development of this work so that we celebrate this work and use the celebration of the development of this tool to publicize it. So that's what I would do. And I would be very happy to work to do both, to document the development and to celebrate its use and use that to advocate for action. Thank you. Over to you, Audrey.
Thank you, Chandra. So let's get and see anyone who has replied. Also, Anna was said, we will use chapter 1 to help our teams frame the discussion and conversations so that everyone is starting from a common understanding. And then Judith also said, also use the guide research on how best the issues concerning adolescent sexual reproductive health is concerned. And then Judith also said, I will use its pointers to boost my research in order to address the gaps in the law that can be addressed in a manner the kit provides solution to what law in the country don't address. Thank you for all those answers. Next to question 2, how can you adapt, meaning us all, how can we adapt your programming to address the unique needs of adolescents? So welcome again, feel free to chat or unmute yourself to answer the second question. Vivian is saying child and adolescent initiatives will use this toolkit to guide the participatory barrier analysis we are conducting in Kenya and Philippines. Already use our literature review. Thank you, Vivian.
Any other thoughts on the second question? How can you adapt your programming to address the unique needs of adolescents based on what you've heard so far?
Yeah, let me come in here. This is Loretta speaking. I'd say for us as Girls Power Initiative Nigeria, it would be meaningful participation with the adolescents themselves to get to understand the needs and build life skills that help them navigate in finding solutions, as well as providing useful information on how well they can manage their needs. Thank you.
For those that also have something else to add, you can even add it in the chat box. If you're not comfortable to speak up, please let's make this group very engaging. We are all young people and we're all experts in our field. Let's brainstorm
And if we're
of
not young,
how
we are
we can.
young at heart.
Yes, yes, Chandra, young at heart. So this is the platform for us to all brainstorm on how we can help to adapt in our programming to address the unique needs of adolescents. Someone just commented in the chat box, they said, child initiate, oh no, this was a response from the first question. The second one, Judith said, having a more rights-based approach in regard to the adolescents. I'm sure this really applies to some of the issues, for example, in Zimbabwe, the one that we had been facing. We had an issue of age of consent and the access to sexual and reproductive health services, where you could see that adolescents who were below the age of 16 years were not allowed to access sexual and reproductive health services. So through this toolkit, we can use it as a tool for us to advocate towards policy change to ensure that everyone has access to the sexual and reproductive health services. Nina, over to you. Maybe you'd want to take it up.
Hello everyone. Hi Audrey, can I have a chance? This is Vivian.
Yes, sure.
Yeah, so for our Child and Adolescent Survivor Initiative, as I said earlier, we are doing a participatory barrier analysis in Kenya, and we would want to see the participation, the meaningful participation of adolescents. And in this regard, we are actually at the process, now we are at this first phase of the project where we are doing some scoping to see how best to engage adolescents in this process. And so I think the toolkit meaningful participation approach is something that we would refer most to look at how best we will engage the adolescents throughout the research in Kenya and Philippines, and also looking at the role that we do as child and adolescent survivor, which involves supporting different country programs to see to it that children and adolescents have access to services in their specific countries. I think this toolkit will also be more of a reference material, something that we can tell countries to refer to most when they are actually thinking about SRA services for adolescents. So for us, it will actually, it's a document that will really be of help to us in terms of preparing and also encouraging different country offices to use it for reference. And also looking at the integrated SRA services. This is something that we as CASI had also started discussions last year with different countries to see how best we can do the integration. And so I think that chapter again will also give us that opportunity to see how best this document can guide us through that process of integration. So that is it from over to you.
Thank you so much, Vivian. That is so wholesome, especially the part about the integration of SRH services. I think it's also in connection with a comment that's in the chat box. Someone said, not in direct answer to the question, but I think this is going to have increased pertinence in wake of COVID crisis and possible corresponding increases in adolescent pregnancy and emerging socioeconomic issues. So this whole COVID situation, we are in a humanitarian crisis. So this cannot be any better time for us to have this toolkit to use it in all of our programming. Another comment was saying consulting the adolescents to understand their needs so that we formulate it accordingly. And then Anna, also from Endanger Health, said, I really appreciated the focus on the socio-ecological model in chapter 1, as sometimes we view working in humanitarian crisis settings as being completely different than our other health and development work. While there are differences, the socio-ecological barriers, the structures are still there, and we have to address them in this work. And Judith also said that advocacy is important. Some governments have not yet recognized the need to reach out for the youth. It is our role to use the kit to create awareness and improve the methodology of reaching out to the adolescents. The toolkit will be used to provide the how on achieving the goal of responding to the needs of adolescents. And then lastly, Jessica said, by involving adolescents in the design of the programs that address their issues, this will enable us to know and understand what their needs are. Thank you so much for all of those that have contributed in the chat box. Is there anyone else who would like to input? Maybe Nina, you'd like to take it up again?
Yes, I had to reconnect for some reason. Sorry, everyone.
No, that's fine.
Yeah, I think I can't see the chat anymore, so that's another trouble. But I would like to welcome Shukti to go on to the next chapter, if that's okay. Thank you.
Thank you, Nina.
Thank you, Nina.
So, hello everyone, I'm Shukti, and I'll be taking up chapter 6, which is the ASRH services and interventions. So we'll be moving on to like 3 categories in this, and the first category is adolescent friendly services. So adolescent friendly services in this main aspect, they describe the 5 principles of adolescent friendly services in a colorful table that includes examples or applications of these principles in humanitarian contexts. So just for all of your information, there are 5 principles in this adolescent friendly services table. And there are the 3 A's, which are the accessible, acceptable, and appropriate, and the 2 E's, which is equitable and effective. Just to give you an example, when we're talking about acceptable, like I'll just take one of the principles. So if we're talking about the acceptable principle, the point of service delivery is to ensure privacy and healthcare providers that are non-judgmental and considerate to adolescents and relatable to adolescents as well. So that's one of the examples from the principles that this table speaks from. So moving on, There's also training and capacity building of staff. So this provides training guidance and tools for building the capacity of SRH managers, in addition to materials for them to train service providers and community healthcare workers. So mainly SRH coordinators and managers, is the key focus of that is to aid them with comprehensive understanding so that their planning is adapted to the context, and blended learning approaches are used by them as well. And the service providers, the key focus is to impart them understanding on the three important domains, which is the basic concepts of adolescent health, sexuality, and effective communication, and the laws, policies, and quality standards, the clinical care for adolescents with special considerations as well. And when we're talking about community health workers, it's to impart understanding on three important domains. And it's also mentioned in the toolkit. So there's a lot of importance to give adequate training and capacity building of staff in when it comes to adolescent SRH services. And the section also provides guidance on conducting orientations for non-health staff to ensure holistic programming across all humanitarian sectors. So when we're talking about non-health staff, they can be like receptionists or anyone from the department, so that they can be stigma free and non-judgmental towards adolescents when they're accessing SRH services. So moving on to facility-based services, this discusses all of the SRH services available to adolescents at the health facility, as well as those connected to the health facility, such as mobile health teams, telemedicine, and self-care approaches as well. So when we're talking about the range of essential SRH services, it has to be delivered via facilities. And like we mentioned about not like going beyond the institutional based approaches. It would always be, mobile health teams, telemedicine, and self-care approaches. These are, even during the COVID-19 pandemic, a lot of my friends as well, they started a blog, and they made, they started approaches towards telemedicine so that a lot of adolescents could access this. And, it's all become digital. So that's a really good perk of all of that. And the toolkit talks about it in detail in a lot of contexts. And a major tool included in this section is the ASRH Health Facility Checklist, which can be used to assess how responsive the facility is to adolescents' needs, and it can be used for monitoring quality of the SRH services and information provided to adolescents as well. So basically, the features of making facilities appealing to adolescents is very important, and monitoring and quality assessment of facility-based services is also important. And the involvement of adolescents in these operations and assessment of services is highly important because of meaningful youth engagement as well. And counseling services, principles of adolescent-friendly counseling and tools are some of the main aspects of this. So I think we can move on to some questions that we would like to hear from the participants. So the first question is, from your experience, what are some of the challenges that adolescents face in accessing SRH services during the crisis? It could be in context to the COVID-19 pandemic as well. So from your country or from your region, there might be a variety of challenges that adolescents face with respect to SRH services. And we would love to hear from you about that, you could type your response in the chat box as well. And you can also think about how it would be relevant to the toolkit and some of the main aspects in the toolkit from chapter 6 as well, as I just pointed out. So yeah, over to the participants.
Please feel free to come off of mute or put your thoughts in the chat.
Okay, you said even people young at heart can speak, so I'm going to try to push you along. I'm 62 years old. I had sex before I was married. I met a young woman who became my girlfriend, and then later on my wife. And so we wanted to have sex, and so I was living in Hyderabad, in India then, to looking for condoms, and it was extremely hard. Of course, we had a wonderful family doctor that I could never go to, so I would go to a pharmacy far away from home where I was sure my mother would never go and get the condoms. And sometimes I was thrown out of the pharmacy. I can still look at close my eyes and see the look of disgust of some of the pharmacy shop owners when I went and asked for condoms. They said, you should be in school. I don't think that has changed very much in many places. And I think it's not just the problem with humanitarian situations. Young people are supposed to study or to be good at home and go to church. Come on, let's speak frankly about how it is.
That was very informative, and personally I can totally relate because a lot of my friends are afraid to access all the SRH services that are available to them because of the stigma and the judgmental looks they get from the medical stores and stuff. So I think that's one of the main problems that my country faces, India. So there's a few responses in the chat box. Judith says lack of information about the availability of the services and the fear to seek the services, and the lockdown has also restricted movement. And someone says stigma in accessing services, which is what Dr. Chandra just spoke about, and no availability of SRH services targeted to adolescent and young population. That's a great point because it's in general, it's not targeted to just the young population. And there is also an issue of costs, and there's conservative politics, lack of SRH services. Access to SRH services would require an adolescent to be accompanied by parents or adults, which sometimes makes adolescents decline payment for SRH services. Absolutely, because a lot of adolescents are uncomfortable going with an elderly person and they would want to access it by themselves. And due to the stigma, they're unable to do that. And perceived stigma, again, of being stigmatized is the first barrier to get access to services, even if they are available. Disinformation, lack of information on range of services, and some laws in countries like those against abortion cause adolescents to get services from unqualified persons, and in the end some have to die or have lifetime health consequences. There is a problem of laws that restrict access to healthcare. That's very true. And Edna says lack of knowledge on ASRHR and where these services are offered. They also fear being judged by the service providers. Again, this related to having non-ASRH trained personnel, and lack of financial means again. And most of it lack of proper family support. I also believe lack of skills to work with and deal with adolescent issues by health providers, cultural barriers again, and Sarah says the toolkit presents the opportunities that self-care provide for increasing access to SRH services, and we should take advantage of this and develop strategies for programming self-care in humanitarian situations. Again, Jessica says religious and cultural beliefs.
Maybe
I think,
just jumping in real quick. So we only have 5 minutes left, first of all, and then I just highlight, the everything that people are saying, even starting with what Chandra said in terms of stigma, cultural barriers, cost, lack of information. These are all further exacerbated in humanitarian settings when it's a new environment, when people are displaced, when adolescents are separated from their families. And so the toolkit has these, the package for, as Shukti mentioned, for the health providers, but also for non-health staff as well. And in addition to the technical training, it also has exercises and tools around things like VCAP, values clarification and attitudes transformation, other approaches to address gender, social norms, both among the health providers as well as at the community level. So really great if you can spend some time looking at this chapter after the launch as well. Thanks, Shakti. Over back to you.
Thank you, Anushka. Since we have only 5 minutes, let's jump to the next question. How is this toolkit applicable to the COVID-19 context, especially when many mobility is restricted? It would be great if you can use the chat box or come on audio as well.
I think someone had already started talking about mobility being restricted, and therefore SRH services were even more limited. There was mention of the shift towards telemedicine so that adolescents could continue to receive information and services. Maybe someone who had mentioned that in the chat, would you like to come off of mute and share a little bit more about that example?
Hi, Anushka, this is Edna. Do you guys, can I jump in on this?
Please, go ahead.
Yeah, the fact that we are having this tool at this time, I want to give an example of our Kenyan situation where during the COVID crisis, we had a lot of adolescent girls getting pregnant, and people realized it after it had happened. So having this toolkit at this time would also awaken us and also alert people that, of course, adolescents have issues they're dealing with. Instead of us waiting for them to get pregnant, then we realize that there is this problem. If we were aware of it, if we had raised a lot of awareness of it, we would have prevented it. We would have allowed our girls to access contraceptives, would have talked to our girls about safer sex practices and all that. But because people kept quiet, we reached where we have reached. But having this toolkit will lighten us, the health providers, the parents, and even the community at large to know that these problems are there and we need to address them.
Absolutely. I think the toolkit is like a boon because everyone would be educated about it and would be more informative about it across all age groups as well. Yeah.
Yeah. I also have something to say, Shukti.
Yeah,
it's more of a case study of what was happening in Zimbabwe during the lockdown. Oh, Laura just said we've got 1 minute remaining in the breakout room, so I'll just make it very snappy. So here in Zimbabwe, you find that most of the persons that are on antiretroviral therapy, they could not go to the clinics to access their treatment. So they ended up forming community groups, community refill groups that whereby one person can go to a clinic and then they'll have to fetch the antiretroviral therapy for them, and then they'll then distribute it within the community. But before this was made, and even still, this was only an initiative that was done in one certain community. In other communities, other people ended up defaulting because they couldn't access their antiretroviral therapies. treatment. So they ended up asking their neighbor if they're on the same regimen, if they can advance them a week supply and things like that. So I think that this toolkit will be very helpful in making sure that adolescents and young people have access to sexual and reproductive health services. So since we don't have much time, thank you so much. We're now running down in less than a minute. We'll be back into the group. I will be giving you the summary of what we were talking about. But thank you all for engaging in the chat box, as well as all of your contributions. We've noted them down. This session was also recorded for those that might have missed something. Once again, thank you so much for taking part. Please don't leave the Zoom meeting. Join back in the main room. Thank you all to our participants and the facilitators. That's it from me.
Thank you.
Everyone.
Thank you, everyone.
Thank you, everyone.
Many thanks. It was great to be part of this group. All the best with the good work you all are doing. Thank you, Anushka.
Thank you, Chandra. It's a pleasure to have you in our group. You're like a guru in SRH.